Cheek piercings, also known as dimple piercings. Pros and cons by a piercer. Going to give you 5 of each. Advantages, disadvantages. Also going to cover what you should know beforehand, getting the piercing, healing the piercing, jewelry, living with the piercing, and what happens if you decide it ain't for you and take it out. Coming up next on Pros and Cons by a Piercer, Season 2, Episode number 22, so you might want to just stick around. For those who are new to the channel, first off, welcome to the channel. Hope you're enjoying the videos. Hope you're finding them informative and entertaining. But you may not know exactly who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So, when I talk to you about these things, I'm talking about a level of expertise that comes from me in the body piercing industry for well over 27 years. What we're going to talk about today is the cheek piercing, the dimple piercing, those that are right on the side of your face. I no longer offer this piercing. And the reason why I no longer offer this piercing is I got tired of turning people away and disappointing people. It is just one of those piercings that unless you have the perfect anatomy for it, it just isn't a good idea. Even if you have the perfect anatomy for it, it may not be a good idea. And we're going to get into all those reasons here in a bit. The thing is, with the placement, it's usually done somewhat even, or at least trying to get even to the anatomy. It is between these two large muscle groupings that we have on the front and back of our cheeks, kind of a hollow point right there, usually in alignment with the first molar or set of molars. It's done in the tooth line, not above or below, to try to limit the amount of contact and damage. And it's done with labre studs, not barbells. Labre studs, or labrettes, if you care to call them that. As far as the history of this piercing, there is some documentation that some of the tribal cultures native to Alaska or the islands around Alaska did this particular piercing as a permanent thing. But for the most part, there's just not a lot of information that I can definitely say, yeah, that's where it came from. As far as the modern times, well, first off, I should mention that it's done in a number of rituals, but those are more temporary, also usually throughout South Asia. It's been done by sideshow people forever, too. As a permanent piercing, is something you wear jewelry in. That's a modern invention. Probably, I'm guessing, was developed, because there really isn't a lot of documentation about it, but was developed at Gauntlet probably in the early to late 80s, maybe. Okay, so with that out of the way, let's move on to the pros, the advantages, the things that make you want to get this piercing. And then we'll move on to the things that don't make you want to get this piercing. First off, it is an established piercing. As I stated, this has been being done for probably the last 30 to 40 years. It is possible to heal out cheek piercings. Is it a great idea too? We'll get to that later. Number 2, it causes dimples. I know a lot of people want this piercing because it causes dimples. Now, when we say dimples, we're really saying it creates scar tissue. Very noticeable scar tissue, usually deeply indented into the cheek. Now, some people like that look because it's like little dimples. Other people, it does not look good. So remember that. Number 3, this is an extremely rare piercing. This is not a piercing that you see very common or very often. Regardless of what you see on the internet, that's just a handful of people out there, I think, that really have this piercing and have it for a long period of time. It has always been a rare piercing. It's not a common one. It's one of those ones that, most piercers, on average, maybe do 1 a year, 2 a year, depending on the area of the country or world that they're in. It's just not a high-in-demand piercing. So seeing one in the wild is pretty rare. Number 4, there's lots of different jewelry ends that you can put on this, from just simple balls all the way up to very expensive and very elaborate ends. It's threaded jewelry in most cases, and there's a lot of stuff out there and available. Number 5, because this is pierced pretty much to have contact with the teeth, and there's a little bit of real estate there between the gums, this one doesn't affect bone structure as much or cause damage as much as, say, a tongue piercing would or labret piercing and a lot of other piercings. However, it's in contact with your teeth, so it's still going to possibly cause some issues there. Well, that's the end of the pros, the advantages, and let me tell you, I really had to stretch and pull the old mind muscle to come up with very positive things to say about this. Anyway, if you haven't already, give me a thumbs up. Let me know that you liked it, because we like it when you like it, especially if you liked it or found it entertaining or educational. If you haven't subscribed, please subscribe. Hit that notification bell so that you're notified every single time we post something. Now let's move on to the cons and disadvantages, the things that say, yeah, this is a not great idea, the things that make you go running into the night away from that piercing studio. Number 1, the swelling on this one can last up to a month or longer. They swell a lot. It is very uncomfortable. It is not, a tongue piercing, yeah, that swells a little bit. The lip, it swells a little bit. Cheeks love to swell and continue to swell much longer than any other piercing that we do. Even out of all the oral piercings, it is the king of swelling, or queen, or leader of the pack. Number 2, as I said, it doesn't really have as much contact with gums in the bone structure of your mouth, but it does with teeth. And it can cause damage. It also, in possible likelihood, especially if the placement is incorrect, can cause a lot of damage to your gums in the bone structure of your mouth. Number 3, my favorite, you can leak saliva out of it. Isn't that attractive? We have no way of knowing where those saliva ducts are. And sometimes the saliva ducts will actually form into the piercings. At least that's the theory. It will leak out saliva out through the side of your cheek. And, it will continue to do that, even sometimes after you remove the jewelry and abandoned the piercing. Number 4, scarring. Yeah, I know people call this a dimple piercing because they want dimples, because they think dimples are cute. Ask anybody that's had them for their whole life and been constantly squeezed and poked and prodded for having dimples. I don't think they would ask to have them. However, we all want what we don't have. Let's face a fact. What you're doing is you're creating large indentation scars on the side of your mouth. It's not, or the side of your face. It is not going to go away. It may fade over time, but they are pretty much one of the longest lasting forms of scarring that you can have from a piercing. They are very prone to being noticeable years after you remove the jewelry. So if you don't like scarring, you don't want somebody to know that you have a lot of people have this kind of concept that, it's only temporary, it's a piercing, I'll take it out. If you're one of those people that thinks that 10 years from now, nobody's going to know that you had cheek piercings, you're probably going to be mistaken, because that scar is going to stay with you, both of them, and they're going to be very noticeable. Now, the last one, number 5, it can be very difficult to find somebody that's willing to do this piercing that knows what they're doing. Sure, you can find a lot of people out there in the piercing industry that are willing to do this piercing, but are they going to do it correctly? Do they have any experience doing it? Probably not. Especially if they just kind of, come on in, sit down, let's do it. And don't go through a big, long explanation of why they don't like doing them or why they feel like they're not maybe the best option. Before I move on to some things that you should know beforehand, let's talk about merch. We have plenty of merch items, including this one. Lots of designs, lots of different products, from T-shirts to beach towels to throw pillows to banners to stickers. We got stickers on there. Leggings and, of course, T-shirts. Lots and lots of T-shirts. Lots of different designs, lots of different colors. Fun stuff. Check it out. Link is in the description. Also, there's one of those merch bars down below. Now let's move on to some things that you should probably know before you get this piercing done or consider. First thing is you need to find a piercer that is well experienced with doing this particular piercing, has a lot of knowledge of anatomy, a lot of knowledge of where it's going to work and where it's not going to work, and also is willing to inform you of the issues associated with this particular piercing and be ethical enough to go, I don't feel the tissue or your muscles are out of the way enough for this to heal properly, and I'm not going to do it. Sometimes it's very hard to find that piercer. They may claim to be able to do them, but the reality is they probably have never done one in their entire career. So take that into consideration. Ask to see photos. Ask to see evidence of piercings and healed piercings. Now, they should give you a consultation. That consultation should heavily cover the risks that are involved with this piercing. We've already covered some of those, like enamel erosion, gum erosion, softening of the bones inside your mouth, the massive swelling, the scarring, the saliva leakage, etc. They should also talk to you about what it's going to take to heal it, what that commitment's going to be like, which is going to include rinsing. It's going to include cleaning twice a day, and practicing cross-contamination prevention. And we will get into that later. This will also change your diet for a short period of time to help reduce that swelling. As I stated before, but I'll restate, the piercer should have done a number of these and completely understand what's involved, not only with the piercing process, but healing it. And they should have proof of that. The piercing should be done with Libre studs. A lot of people do these with barbells, and I don't really advise it because that ball is going to be in contact with your teeth and cause issues and make the thing a lot worse. The increased movement with these, because we have to put in such long posts, will actually prolong the swelling, prolong the healing, and cause a whole number of other problems. However, that flat disc does help to keep it away from teeth and gums. So I really suggest that these are done with a Libre stud. Now, with the Libre studs, it's usually a much longer piece of jewelry than we would normally do any other oral piercing that exits the face. Usually with these, you're looking at 5/8 to 3/4 of an inch in length. They can stick out, kind of look like antennas. This will also make the piercings look less straight, more crooked, what have you. So, and the other thing with this piercing that you should know is that you may have to go through multiple different pieces of jewelry, downsizing over time, during the healing process. Most piercings, you downsize once and that's it. This one, it may involve downsizing, from 3/4 down to 5/8, down to, let's say, 1/2 inch, and then down to whatever your final one would, which may be around 3/8 of an inch. So you're not going to start out with exactly the same jewelry. You're going to have to, that's an additional investment in most cases. Most studios do not sell or give those away during the process or included with their prices. So that's going to be additional cost. Plus, there's those lovely studios that charge you to change jewelry. So that's some more cost. And you should ask them about what their downsizing policy is and what that's going to be like. Now, they should talk to you about and forewarn you about saliva ducts. In some cases, I've even heard of piercers, they will send you to your doctor to determine whether or not they will mark the area they think it should be pierced in, and then send you to your doctor to determine whether or not there's saliva ducts there or not. It's really difficult for us to know what's under that tissue. It is not our expertise. We try as much as we can to study the area, but because we're all unique to individuals, usually with ducts and blood vessels and etc., they are routed different from person to person. So another thing they may do is they may try putting a flashlight in your mouth to kind of determine where it's at. Candling is what it's commonly called. That might help, but they're not easy to see. Just to recover these very briefly, they should advise you of the risks, not only to damage of the structure of your mouth, but also that you are going to be more prone to STDs during oral sex. So if you switch partners, you're going to have to practice safe sex. The other thing they should inform you is the changes in diet that you're going to have during the healing process. Finally, a couple things I always kind of stress is you need to talk to your piercer and find out whether or not they supply aftercare product, and if they don't, where you can purchase it from. It's just so much easier to have that stuff on hand before you get the piercing than running around looking for it. Last thing I always suggest with an oral piercing is go have a really good meal beforehand. Eat at your favorite restaurant or prepare your favorite meal. You're not going to be able to eat what you want for a while. And in some cases with this one, maybe 2 weeks, maybe a month. So really go out and kind of indulge yourself before going in because you're not going to be eating that stuff for a while. Now let's talk about the piercing experience itself. First off and foremost, they should give you a consultation. They should describe to you all the issues that are associated with this, all the risks, what it's going to take to heal it, what that commitment's going to be like. They should talk to you about swelling, of course, and some of the other things I've already talked about before we got to this point. They should also talk to you about the jewelry selection and the type. As I said, you should be done with labret studs. Then you're going to fill out a waiver. They're going to probably ask you about any metal allergies you have or any other allergies you may have, medication that you may be on, and health issues. If you do have health conditions that may impede your body's ability to clot, blood clotting, and also to heal, you need to discuss that with your doctor before you get the piercings. We are not your doctor. We do not know how that condition may affect not only the piercing experience itself, but how that piercing heals. Whenever in doubt, talk to an expert. The waiver should also include if you're on any type of medications, controlled or uncontrolled substance that may impair blood clotting or cause unusual complications. And once that's over and done with, they will begin to, of course, they'll scrub up, begin to set up the equipment that they're going to need for the piercing. Once that's done, they will usually disinfect the area of the cheek with a disinfectant surgical scrub, and then probably have you rinse with maybe an antiseptic mouthwash. Next up is marking. Marking is going to involve feeling around a lot, maybe even putting their thumb in and kind of trying to find that hollowish area. And then it's going to be addressing where your teeth are, and then once they've figured out the anatomy, what they're going to do is try to place them so that they match correctly. Like I stated earlier, the best placement for this particular piercing is usually even with the first molar and in the teeth line in between those two muscle groupings. Now, they might not measure, if you take out a tape measure or caliper and try to get it exact, they're not going to be there. We always pierce when we're doing things that are symmetrical from one side to the other because your face is not shaped perfectly exactly the same on both sides. We try to make it appear to. When looking at the markings, look at them up close and then look at them at arm's length. This, most people won't see you from this length, but they will definitely see you from further away. They should appear like they're even from further away. Up close, they may not. Now let's get into the actual piercing itself. I personally, the ones I've done with this one, and what I generally would suggest is using Bollinger or sometimes called sponge clamps, forceps or sponge forceps. Basically, the same thing we use for tongue piercings. Basically, because you want to compress that tissue and it's kind of further back in the mouth, and Pennington forceps are just not going to match. They're just not long enough, and even if they are, they're really uncomfortable. So basically, this piercing's done outside to in, usually, and then the method is they are pierced from the outside in. The needle is pushed out with a guide pin or taper pin. The jewelry is attached to the guide pin or taper pin on the inside of your mouth, pushed back through, and then the end is put on. Oftentimes, this is done kind of like a tongue piercing with those forceps in place for the whole piercing in jewelry insertion. Now, after the fact, you're going to have probably a little bit of throbbing, aching, tenderness of the touch. You might see a little bit of slight bleeding off and on for a few minutes after the piercing is completed. Really, the part that usually takes the longest with this particular procedure is actually tightening on that ball. Be patient. Sometimes they can be a little tricky. Now, sometimes some bruising can occur. That's normal. It should fade within a few days. If it doesn't, seek medical attention or at least contact your piercer. The jewelry is going to be extremely long. That is normal. That's for the swelling. It's going to be odd. It's going to feel weird. It's going to look goofy. Sorry, that's just part of the procedure. Hopefully, your cheeks do not swell to the length of that jewelry. However, most of the time, they will. Now, it's going to feel strange to have them in your mouth. It's going to take a little bit of time to adapt to that. You're really going to kind of stick with, and we'll get into this with the healing, simple foods until you're used to it. But don't be surprised if this feels really awkward at first. Eventually, it will become second nature to you and seem normal. Now, let's get into healing. Average healing time on this piercing is 12 to 18 weeks, during which time you're going to want to clean twice daily using a sterile saline solution. I like Nail Med's piercing aftercare. Also, you're going to want to rinse for at least the first month or so with a antiseptic mouthwash that is alcohol-free. Personally, I like Biotine antiseptic mouthwash. Also, warm saltwater rinses a couple times a day, maybe more if it feels good, will help with the healing process. Then you need to practice cross-contamination prevention. Common sense stuff. Wash your hands before you handle it. No oral contact, deep mouth kissing, or sexual contact for a minimum of 12 weeks. You are more acceptable to STDs during oral sex, so if you switch partners, practice safe sex the way you're supposed to. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing. Do not submerge the piercing in bodies of water you cannot control the quality of, which is pretty much everything but your own clean bathtub. So no swimming. None. Keep cosmetics away from the area, especially powder-based or foundation makeups, until it's healed. Do not share food items or utensils with other people. Make sure that your own food item, or your own, not so much food items, but your own utensils are cleaned on a regular basis. It's a good idea to start with a fresh toothbrush just to be on the safe side, and do not store that next to the toilet in the bathroom. If I didn't mention this earlier, I'm going to mention it again. Keep pets away from it. Do not let them sleep in the bed with you. The other thing is you want to avoid contact with anything that's unclean or isn't disinfected on a regular basis. Keep wet hair away from it. That could be a possible problem or source of problem. Keep cosmetics, hairspray, all of that stuff away from it. You do not want to sleep on these piercings. You need to sleep pretty much flat on your back. That's really the only position that's going to work for this. Or figure out some way to elevate the piercings off the bed. Avoid playing with the piercing. It's natural to play with anything that's in your mouth. To reduce swelling, you're going to probably need to go ahead and change your diet. You want to cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things extremely warm in temperature, or anything that may agitate your mouth, especially in the first 3 to 5 days, because that tends to build that swelling. Don't be surprised if the swelling lasts 2-3 weeks. During which time you may have to downsize the jewelry to kind of reduce some of the movement that you're seeing. Like I said earlier, you need to discuss that with your piercer. One final thing is sleeping with your head elevated above your heart will help reduce the swelling. Also, eating lots of cold items is your excuse to raid the freezer. And if you didn't watch the last one I did, there is absolutely no reason why you can't eat dairy. Dairy is not going to cause yeast infections. You're not going to get a yeast infection in your mouth. What you may get is thrush, and that has nothing to do with eating dairy. That has to do with over-cleaning and having it break down the natural enzymes of bacteria that live in your mouth and getting an outbreak of thrush. In fact, yogurt, especially Greek yogurt, is good for you and good during a healing process because it's going to probably help reduce the likelihood of thrush. So dairy is perfectly fine. Now, with any oral piercing, a white ring of tissue may form around the jewelry on the inside. That's normal. It's scar tissue. You might see kind of this yellowish, nasty-looking snot stuff that hangs off of it. That is discharge. Just like on the outside where it's hardening and collecting, on your inside, it does get produced. It just can't harden and collect because it's warm and moist. Leave it alone. It will fall off on its own. Another thing is it's not uncommon for the labret disc to nest where it kind of indents a little bit. This is actually a good thing because it's going to help keep it away from teeth, gums, and etc. I'm going to say this one more time, and then I'll probably say it a couple more times. Downsize as soon as possible and plan on doing it possibly multiple times. Now let's start on with jewelry. You should leave the jewelry in at all times, never taking it out for long periods of time. You generate tissue pretty rapidly inside your mouth, and it's not uncommon to have this piercing for years. Take it out for a couple hours for either an MRI or a job interview or what have you, and have problems getting it back in. So if you like these piercings, leave the jewelry in. Only take it out to replace it. Once again, the jewelry should be downsized as soon as possible, and don't be surprised if it's done multiple times during the healing process and the swelling process. Once you get down to that final piece, you shouldn't have to downsize anymore, but plan that ahead of time. You should always wear labret studs. Do not wear barbells in this or curved barbells. You need a flat back, straight pose. That's your best option because we really want to keep that jewelry away from your teeth. Always check the end of the jewelry to make sure it's on there tight. They can unscrew on their own, and they usually fall off at the worst possible time. And there is always a possibility of swallowing jewelry. So always check them a couple times a week, even after the piercing is healed. Time to talk about living with the piercing. The jewelry should be left in at all times, once again. Monitor your teeth, your gums, and the bone structure of your mouth. If you start to notice discomfort, pain, etc., or physical damage, if you can tell, take the damn jewelry out as soon as possible and throw it away. Never put anything back in there. There is no way to repair damage to your gums, teeth, and etc. by just simply taking the jewelry out for a couple hours and then putting it back in. If you start to see those problems, they're not going to go away. They're actually going to probably get worse. Of course, as I mentioned earlier, check the tightness of the balls on a regular basis. Sometimes plaque can collect on that jewelry on the inside. Usually brushing it with just toothpaste will get rid of that, or using a plaque rinse. If it requires taking it out, you can take it out and clean it with like denture cleaner if you really, really want to be avident about it or a little OCD. Now with the saliva, if you begin to notice it, monitor it. See your doctor about it. Chances are is the only way that's going to stop is if you take it out, let the piercing close, and if it doesn't stop at that point, seeing a medical professional and having them basically repair the damage you did with your piercing. Now, lastly, abandoning the piercing. If you've gotten to the point where you just had enough of this and you're just ready to just give it up, if it's during the healing process, you just kind of want to keep an eye on it. It's going to close like any other wound would on your body. Monitor it. Make sure there's no signs of infection. If any signs of infection occur, contact your medical professional as soon as possible. If the piercing's already healed, what will happen is usually the inside will close. The inside of the mouth will close probably the fastest. Then the piercing will kind of pinch together and then slowly fill up. Like I mentioned earlier, this piercing is prone to scarring. You're probably not going to see much fading even after you remove the jewelry. If you were having the saliva duct thing, as I mentioned just a few minutes ago, I monitor it. If it doesn't stop, I would say within a couple of weeks, go see your doctor. Now, occasionally, if the piercing holes appear open or somewhat open, you might see sebum connecting or collecting in it. Dead skin cells have a very distinct odor to it. It looks like cottage, or not cottage cheese. It looks like cream cheese, another cheese. And stinks like really bad. Don't worry about it. It isn't a sign of infection. It isn't a sign of any other problem. It's just basically oils collecting in there. Usually if you just clean the area and practice some hygiene, that's about it. So that's it. That's all the reasons why you should not probably get a cheek piercings or dimples, no matter how cute you may find them. If you have any questions or you'd like to add, or you have these piercings, you'd like to give us some of your experiences with these particular piercings, please leave a comment. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Thank you for watching. Take care of one another, and we'll see you in the next video. Probably one of these.